nation's readiness to confront infectious diseases and biosecurity threats, end quote. That was what Secretary Kennedy said on July 31st. On August 27th, less than a month later, Dr. Monarez was fired. Why was that? Well, according to Secretary Kennedy, Dr. Monarez, who has spent nearly 2 decades as a public service working in both Democratic and Republican administrations, he said that she is, quote, a liar, end quote, and is, quote, untrustworthy, end quote. Liar and untrustworthy. Really? How did Dr. Monarez go from being a public health expert with unimpeachable scientific credentials, who had the full confidence of Secretary Kennedy, into being a liar and untrustworthy in less than a month? That is quite a transformation. Well, I think the answer is fairly obvious. Dr. Monarez was fired because she refused to act as a rubber stamp to implement Secretary Kennedy's dangerous agenda to substantially limit the use of safe and effective vaccines that would endanger the lives of the American people and people throughout the world. Specifically, she was fired for 2 reasons. Number 1, listen to this. She refused to, quote unquote, pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric, end quote. In other words, and this is quite important, she took the radical position that she wanted to examine the scientific facts before drawing conclusions. I would hope that that is the very least we could expect from any public health official in the United States. And number 2, reason why she was fired, she refused to get rid of career scientists for doing their jobs, including Dr. Howry, who was then the chief medical officer at the CDC. Bottom line, Dr. Monarez stood up for science, for public health, and for the scientific method. Frankly, she stood up for protecting the well-being of the American people, and for that reason, she was fired. But Mr. Chairman, let us be clear. This hearing is not just about determining why Dr. Monarez was fired and why Dr. Howry and other scientists at the CDC resigned. The issue is deeper than that. It is about Secretary Kennedy's dangerous war on science, public health, and the truth itself. Unacceptably, we now have an HHS secretary who does not believe in established science and who listens to conspiracy theorists and ideologues rather than doctors and medical professionals. It is absurd to have to say this in the year 2025, but vaccines are safe and effective. That, of course, is not just my view. Far more importantly, it is the overwhelming consensus of the medical and scientific communities. It's not what we believe. It's what the scientific and medical communities believe. The American Academy of Pediatrics, the country's largest professional association of pediatricians, representing over 67,000 doctors. Those are the doctors we take our kids to. What do they say? They say that one of the greatest public health achievements is the vaccine, which prevents tens of thousands of deaths and millions of cases of disease. That's our pediatricians. The American Medical Association, representing over 270,000 doctors, they say that vaccines are the best tool to protect the public health against illnesses and their potentially serious complications. World Health Organization, virtually every medical organization, every scientific organization, the people who we trust, tell us that vaccines are safe and effective. Mr. Chairman, you will well recall, as other members of the panel, that several years ago when I sat where you sat, you recall that we had the heads of the major agencies talking about pandemic preparedness. How well will we be prepared for a future pandemic? We had, I believe, 5 agency heads. And we all asked them, you tell me, will there be another pandemic in the future? And they all said, well, no one knows what it will be. No one knows when it will come, but the likelihood is there will be another pandemic. And the next question that some of us asked is, tell us, are we prepared for that, God forbid, terrible event? Without exception, Mr. Chairman, you recall, they all said, no, we're not prepared, we're not prepared. So it is not just, what's going on now is not only endangering the health and well-being of our children. Are we prepared for the next pandemic, which could claim millions of lives? Are we doing the scientific research to develop the vaccines, the other tools that we need? And that is what frightens me. So Dr. Monarez, Dr. Howery, thank you very much for being with us. We look forward to hearing your testimony.
Thank you. To begin, I wish to enter 2 statements into the record. The first is September the 2nd op-ed by Secretary Kennedy outlined his vision to modernize the CDC. The second is an article from STAT comparing Secretary Kennedy's op-ed to a memo Dr. Monarez drafted describing her priorities to modernize the agency. The article found the recommendations outlined in both the op-ed and memo were substantially similar. I'm sorry, I need to introduce the witness. My staff gave me that kind of 101. We're joined today by Dr. Susan Monarez, the former director of the Centers for Disease Control and Prevention, CDC. Dr. Monarez was the first Senate-confirmed CDC director. She was previously the deputy director of the Advanced Research Projects Agency for Health, ARPA-H, where she helped oversee a $2 billion portfolio to advance healthcare breakthroughs. Dr. Monarez earned her PhD in microbiology and immunology from the University of Wisconsin-Madison and completed her postdoctoral fellowship in microbiology and immunology at Stanford University School of Medicine. Dr. Howery, we're also joined by the former Chief Medical Officer and Deputy Director for Program and Science at the Centers for Disease Control. Dr. Howery oversaw CDC's 9 national centers and the agency's Office of Science with a combined budget over $6 billion. She also previously led CDC's National Center for Injury Prevention and Control, where she helped lead CDC's work responding to the opioid crisis. Dr. Howery is a graduate of Emory University and received her MD and MPH degrees from Tulane University. She completed her residency training in emergency medicine at Denver Health Medical Center. I shall now begin. Oh, the opening statements, 101 again. Please, Dr. Monarez. Is your microphone on?
Is this on? I believe it's on. Can you hear me?
Yeah.
Close to the mic.
Thank you. Okay. Chairman Cassidy, Ranking Member Sanders, and distinguished members of this committee. Thank you for the opportunity to testify before you again. My name is Susan Monarez, and I am a microbiologist and immunologist. Exactly 12 weeks ago, in this same room, I testified that if confirmed, I would lead the CDC to restore public trust, modernize public health infrastructure, and strengthen the agency's core mission of protecting Americans from infectious diseases and emerging threats. I was honored to be nominated by President Trump and confirmed with the Senate's support. Secretary Kennedy himself swore me in on July 31st, calling me a public health expert with unimpeachable scientific credentials. My tenure as CDC director lasted 29 days. Since my removal, several explanations have been offered: that I told the secretary I would resign, that I was not aligned with the administration priorities, or that I was untrustworthy. None of those reflect what actually happened. I will share the details, but I want to be clear. Today should not be about me. Today should be about the future of trust in public health. The events leading to my dismissal began weeks before August 25th. On August 2nd, I learned from media reports that experts serving as liaison representatives to the Advisory Committee on Immunization Practices, the ACIP, including those from major medical societies, had been removed from its working groups. The following week, I heard concerns that the ACIP might alter childhood vaccine schedule at its September meeting, potentially without credible supporting data. On August 8th, a gunman, driven by vaccine distrust, fired 180 rounds into CDC headquarters in Atlanta, killing Officer David Rose. In the days after the attack, I focused on security, staff, and ensuring the CDC could continue its mission. On August 19th, I received a directive from the Secretary's office that I now required prior approval from my political staff for CDC policy and personnel decisions. On August 21st, I was told to return to Washington from Atlanta immediately, which would have meant missing Officer Rose's memorial, something I was not willing to do. When I did return, I was concerned about my ability to continue to lead the CDC while preserving evidence-based decision-making, commitments I had made to this committee during my confirmation hearing. On the morning of August 25th, Secretary Kennedy demanded two things of me that were inconsistent with my oath of office and the ethics required of a public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign. I responded that I could not pre-approve recommendations without reviewing the evidence, and I had no basis to fire scientific experts. He told me he had already spoken with the White House several times about having me removed. For 3 decades, I have worked at the intersection of public health, science, and technology innovation, always challenging the status quo and welcoming the changes that come from research and discovery. Even under pressure, I could not replace evidence with ideology or compromise my integrity.
Dr. Monarez, you're almost out of time. I'll be generous, but if you could speed up just a little.
Vaccine policy must be guided by credible data, not predetermined outcomes. As I wrote in my September 4th Wall Street Journal op-ed, I agree with President Trump. We should not hesitate to ask for proof about our vaccines. And I also agree with his most recent comments that vaccines are not controversial because they work. Demanding evidence is exactly what I was doing when I insisted CDC recommendations be based on credible science. I was never misaligned with the administration priorities. The goals Secretary Kennedy recently cited publicly, protecting the public from threats, building infrastructure, modernizing systems, investing in the workforce, and enhancing scientific rigor were the same priorities I articulated at my confirmation hearing and began advancing during my short tenure. I remain supportive of those priorities. The question is whether they can be achieved without the expertise required at CDC. Regarding trustworthiness, I cannot define that word for Secretary Kennedy. I made commitments to this committee that I would lead with integrity, transparency, purpose, and work with Congress to maximize health outcomes and protect the American people. Secretary Kennedy told me he could not trust me. I had refused to commit to approving vaccine recommendations without evidence, fire career officials without cause, or resign, and I had shared my concerns with this committee. I told Secretary I told the secretary that if he believed he could not trust me, he could fire me. The next day, I was told I still had my job, but the secretary's expectations remained: approval of ACIP recommendations and dismissal of career scientists. I would not commit to that, and I believe it is the true reason I was fired. Tomorrow, the reconstituted ACIP will meet. Its composition has already raised concerns from the medical community. Based on what I observed during my tenure, there is a real risk that recommendations could be made restricting access to vaccines for children and others in need without rigorous scientific review. With no permanent CDC director in place, those recommendations could be adopted. The stakes are not theoretical. We already have seen the largest measles outbreak in more than 30 years, which claimed the lives of 2 children. If vaccine protections are weakened, preventable diseases will return. I was fired for holding the line on scientific integrity, but that line does not disappear with me. It now runs through every parent deciding whether to vaccinate a child, every physician counseling a patient, and every American who demands accountability. I want to end where I began with my confirmation hearing. I spoke then about the value of hard work, paying my own way through college, and my lifelong dedication to science and public health. On August 25th, I could have stayed silent, agreed to the demands, and no one would have known. What the public would have seen were scientists dismissed without cause and vaccine protections quietly eroded, all under the authority of a Senate-confirmed director with unimpeachable credentials. I could have kept the office, the title, but I would have lost the one thing that cannot be replaced: my integrity. Some may question my motives or mischaracterize my words. That is part of public life, but I am not here as a politician. I'm here as a scientist, a public servant, and a parent committed to protecting the health of future generations. The question before us is whether we will keep faith with our children and grandchildren, ensuring they remain safe from the diseases we fought so hard to defeat: polio, measles, diphtheria, whooping cough, and many others. Undoing that progress would not only be reckless, it would betray every family that trusts us to protect their health. Thank you, and I look forward to your questions.
Thank you. Dr. Ari?
Chairman Cassidy, Ranking Member Sanders, and distinguished members of the committee, thank you for the opportunity to testify before you today. 3 weeks ago, I made one of the hardest decisions of my career. I resigned from CDC. I come to you as a doctor, as a scientist, and a mom. For over a decade, I worked as an emergency physician, treating patients where I saw firsthand how illness and death devastate families and loved ones, and even more devastating when it's preventable. That's what led to my career in public health. I changed my focus from treating individual patients to protecting the nation. I served 10 years at CDC under 6 directors and 4 administrations. In each case, priorities shifted, but decisions were grounded in evidence, transparency, and consultation with the world's best scientists. That has changed. I resigned because CDC leaders were reduced to rubber stamps, supporting policies not based in science and putting American lives at risk. Secretary Kennedy censored CDC science, politicized its processes, and stripped leaders of independence. I could not, in good conscience, remain under those conditions. America's progress in health is one of the greatest success stories in history. A century and a half ago, life expectancy hovered around 39 years. Today, it is nearly double that. And we got there through vaccinations, through safer food and water, through smoking cessation, and through the quiet, steady work of public health